I was invited to EON's 13 at ESMO 2020 this year to talk about two topics. The first topic is about adolescents and young adults and in cancer care. And it's a small area, but it has a tremendous impact if young people and adolescents is confronted with cancer, because they are all in a fast changing and sometimes a very hard developmental stage in life. And that's already hard to deal with. And if you're then confronted with cancer, it has an impact on a lot of things you're dealing with at that age. You're becoming independent, you're developing your sexuality, you're going to school, you finish education, you have your first job. And this could be all affected by cancer diagnosis. So it's tremendously important that young people, adolescents and young adults are supported by cancer nurses to going through this. And it's very important that cancer nurses are knowledgeable. What are the cancer risks? What are the specific cancers that occur in this age group? And what's the best care they can give them? And which topics they should support young people with? So it's very important that young people, adolescents and young adults are supported by knowledgeable healthcare providers and cancer nurses. And one of the important things in the cancer pathway for young people is to start with a comprehensive assessment, that is, assess all these important topics where they're dealing with, so we get an overview and we can provide them the right care they need at that moment to make it more, to let continue their life, and that peer support is continued, that people can go on, get this indication, and how they can tackle their cancer burden during this pathway. So I think cancer nurses have a tremendous important task if young people are affected by cancer. But it's not always only the young person, it's also the parents, for example. And what's happening at that stage of age is that you're becoming more independent. And when you're hit by a cancer diagnosis, young people, sometimes, if they're already independent, they have, for example, have to move back to home and they fall back under the support of their parents. And this could be for tremendous a lot of things, because they want to care for them. They need the financial support. They need the practical support, for example. Parents take up that caregiver role. But at the same time, they need also some support to deal with this, because this is your child that's getting cancer. And therefore, it was a wonderful research team in a hospital that designed a booklet for supporting parents, where a lot of topics they recognize where come forward and where they can find tips and tricks to deal with or give them guidance through this tremendous difficult pathway as their son or daughter is dealing with a cancer diagnosis. So I think this is one of the topics that are coming forward in this great Congress, and I hope you enjoy it.